Just wait on like one member. Not yet. You're good. Two-minute warning. Heads up.
Great. Good afternoon. Thank you for joining us and the amazing doctors of the Dem Caucus. This month marks 3 years since the Supreme Court overturned Roe v. Wade. Ever since, the Republican Party has stopped at nothing to roll back more freedoms, to strip away more health services, and take more steps towards their ultimate goal, a nationwide abortion ban. And despite their promise on the campaign trail, the constant reassurances that they would leave abortion access to the states, they have unloaded a barrage of attacks on women's health care. Because it's not enough for them to slash Medicaid and Medicare. It's not enough to take health care away from 16 million Americans with their big, ugly bill. Now they also are using the budget process to defund Planned Parenthood, to bar abortion coverage from private health plans, to prohibit our servicewomen from traveling to get abortion care. They are trying to eliminate reproductive health care in America, even in states where it remains legal. They are enacting a national abortion ban step by step. And now we're seeing yet another attack from this White House. Under the Emergency Medical Treatment and Labor Act, any person is entitled to emergency care regardless of their ability to pay. Last week, Donald Trump revoked federal guidance that had underscored a legal fact that the right to emergency care includes abortion care if needed. He tossed out that guidance, but the facts remain. EMTALA is still the law of the land. Donald Trump does not have the power to change that law. His callous action did not change women's rights under the law. It did not change doctors' responsibilities to their patients under the law. What it did do is sow confusion. Elected officials and the media alike have a responsibility to make this clear. EMTALA has been on the books for nearly 40 years. It was signed by Ronald Reagan, and it remains the law. Every woman who needs emergency abortion care has the right to receive it. And I am so proud to be joined by the 6 doctors serving in the House Democratic Caucus. They are going to dig into patients' rights under EMTALA and the harm that this kind of confusion can cause on the ground. We're going to start with an OBGYN who's practiced for over 20 years, the gentlewoman from Minnesota, Dr. Kelly Morrison.
Thank you, Madam. Good morning. I guess it's good afternoon, huh? I'm Dr. Kelly Morrison, and I am proud to be the first pro-choice OBGYN to serve in Congress. And we're here today to clean up some confusion around EMTALA. Over the past few days, we've been seeing some extremely concerning headlines insinuating that President Trump has ended access to life-saving abortion care in emergency rooms. We need everyone across the country to know that that is not true. EMTALA is still the law of the land. Donald Trump has not and cannot change that. As an OBGYN who has cared for women for more than 20 years, I want to make 3 points today. First, let's be clear about what EMTALA is. The Emergency Medical Treatment and Labor Act is the federal law that says that no matter what your medical emergency is, you have the right to receive treatment. For nearly 40 years, it has protected patients' rights to get to the care they need when they go to an emergency room. So if you go to an emergency room hemorrhaging, you will get the care that you need. If you go to an emergency room in septic shock, you will get the care that you need. If you go to an emergency room with any life-threatening condition, you will get the care that you need. And in some emergency medical situations, abortion is the life-saving care that you need. EMTALA provides basic fundamental protection for doctors to provide appropriate care for their patients, the care they've been trained to give, the care needed to save a patient's life. Second, the Trump administration's cruel decision impacts all women. All women should be able to go to an emergency room with the full confidence that they will get the life-saving care that they need. No one goes into a pregnancy planning to seek emergency abortion care. No one wants to find themselves in this situation. Remember, we're talking about medical emergencies here. We're talking about times when something goes tragically wrong. So what is the Trump administration even doing here, rescinding this guidance? What is their point? They're inserting politics into emergency care protocols. They're intentionally confusing doctors, hospitals, and patients. They're stoking fear, and they're putting lives at risk. They're refusing to protect pregnant women. And all of this coming as we are facing a worsening maternal health crisis. The United States has the worst maternal and infant mortality rate of any of our peer nations. Instead of taking measures to address this crisis, this administration is instituting policies that will only make it worse. And third and lastly, it's important that everyone know their rights. Patients, no matter where you live or what your state's abortion laws are, you have the right to emergency care. Hospitals, federal law continues to require you to provide stabilizing emergency care to all patients. To our fellow doctors across the country, we stand with you and we will continue fighting to protect your ability to care for your patients. And finally, to the American people, know that we'll continue standing up to this administration's relentless attacks on women and people's access to care. And with that, I will turn it over to my fellow member of the Democratic Doctors Caucus, Dr. Raul Ruiz, and we're especially grateful for his perspective today as an emergency medicine physician.
Thank you. Good afternoon, everyone. Thank you all for being here. Today I'm speaking not only as a congressman, but as an emergency physician who has cared for countless patients in their most vulnerable moments. Let me tell you a story of a patient that suits this discussion very well. She was a young woman who traveled from New York City, came to the Coachella Valley. I was on shift. It was in the late evening. I was one of the few doctors that was working in the emergency department, and the woman had right lower quadrant pain. And as part of the diagnostic workup, I asked her if she's pregnant. She said no. I asked her if she's had a recent pregnancy test. She said yes, about a couple of days before she traveled. But we take our own pregnancy tests in the emergency department, and sure enough, it was positive. And her pain was getting worse. And we sent her for an ultrasound, and they found an ectopic pregnancy in the fallopian tube, meaning that the pregnancy was not where it was supposed to be. It was in a very dangerous place, a place that if it ruptured, it could cause her life. And so as the night wore on, her blood pressure dropped, her heart rate went up, and we were suspecting that indeed she was rupturing, and we called the surgeon who took her to the operating room, and right there her fallopian tube ruptured and she was dying. And so they saved her life. That's what we do in emergency rooms throughout the nation. We save lives. We relieve suffering. We act quickly, without delay, without discrimination, and without politics. That's exactly what the Emergency Medical Treatment and Active Labor Act, or EMTALA, requires. EMTALA is a federal law that guarantees every person the right to receive emergency medical care, regardless of their background, insurance status, or income. It's been the law of the land since 1986, and it is just as vital today as it was then. So let me be crystal clear. EMTALA is still the law of the land, and that includes the right to abortion care when a patient is experiencing a medical emergency, even in states with abortion bans. Like in this case, the woman needed to terminate the pregnancy in order to save her life. But if we allow EMTALA to be weakened or ignored, we risk turning emergency rooms into places of paralysis and delay. Imagine a young woman bleeding out in a rural hospital while staff scramble to interpret state laws or await legal guidance. Imagine a doctor forced to choose between saving a patient's life and risking prosecution. In medicine, uncertainty delays care, and in emergency medicine, that delay can be fatal. That's why I'm reaffirming today, federal law protects emergency abortion care. EMTALA protects emergency abortion care. And I will fight in Congress, in courtrooms, and in every community to make sure that care is never denied. To patients across the country, if you are experiencing a medical emergency related to your pregnancy, you have the right to receive care. This is about protecting a woman's life. It's about honoring the sacred trust between doctor and patient. And it's about making sure no one is left to suffer alone in an emergency. And now I'd like to turn it over to Dr. Maxine Dexter, a pulmonologist from Oregon.
Good afternoon. My name is Maxine Dexter. I'm a mother, a pulmonary and critical care physician, and the proud U.S. representative for Oregon's 3rd Congressional District. Before I came here, I spent 2 decades taking care of some of the sickest patients in the hospital as a critical care physician. We often met ambulances in the emergency room with our emergency colleagues when we knew that somebody was in extremis or crisis. And these patients need, as we just heard, immediate intervention to save their lives. I put patients on ventilators who couldn't breathe, put emergency tubes into a chest to expand lungs, and all of this includes pregnant people who sometimes, unfortunately, come in bleeding uncontrollably, and we have to resuscitate them quickly. They cannot get through that with supportive care while questions are sent to lawyers or other policy specialists. EMTALA is critical to making sure that patients who need emergency care to stay alive have it available, no matter what. And this is an expectation for care that we all must hold dear. EMTALA doesn't carve out exceptions. It is not based on the political whims of a White House. If a patient is hemorrhaging, if her water breaks prematurely, if continuing a pregnancy will cause organ failure, EMTALA protects her right to receive emergency abortion care. That is not opinion, that is law. And no matter how much power Donald Trump believes he has, he cannot erase EMTALA. For emergency care is, at times, emergency abortion care. But what he has done is dangerous. By rescinding the Biden administration's guidance that reminded hospitals of their obligations under EMTALA, he has created chaos, and quite frankly, in the name of cruelty. When hospitals are unsure of their obligations, people suffer. So let me, again, make this crystal clear to every single person listening. Hospitals are still legally required to provide stabilizing care. Physicians are still bound to act in the best interests of the patient in front of them, and all patients are still protected under federal law. We will not stand by while chaos is used as a weapon to steal rights from Americans. In Congress, in the courts, and in every room where decisions are made, I will fight to make sure that the law is followed and lives are protected. Because when someone walks into an emergency in crisis, they do not need politics. They need care. And under EMTALA, they are entitled to it without exception. Thank you. I will now hand it over to the amazing Representative Kim Schreier of Washington.
Thank you, Dr. Dexter, and thank you to my fellow Democratic doctors and Whip Clark for taking the time to stand up and speak out on behalf of our patients and our constituents as the Trump administration continues to muddy the water when it comes to health care and put all of us at risk. I want to reiterate this important point that my colleagues have made, that the President's decision to rescind the Emergency Medical Treatment and Labor Act, EMTALA, guidance, while confusing and incredibly irresponsible, does not change existing law. EMTALA is still the law of the land, and that means that any hospital that receives government funding must provide emergency medical care for anyone who shows up at that emergency room. President Biden clarified, and the courts agreed, that in a case where that emergency treatment would require abortion, EMTALA would supersede any state abortion bans. It was meant to provide clarity for the specific scenario that you have heard about, an obstetric emergency requiring emergency abortion. The Trump administration's removal of that clarification, once again, leaves Americans and physicians with uncertainty about whether they will get the emergency care they need, no matter what state they're in. It's yet another attack on health care by this administration. First, impending giant cuts to Medicaid, and then HHS Secretary RFK Jr. elevating fringe conspiracy theories about vaccines and putting our health at risk. And now causing uncertainty about whether women will have access to life-saving care if that care requires abortion. Now, because the administration can't actually change the law, as you've heard, they're now creating enough uncertainty and confusion that hospitals and physicians might think twice about providing that life-saving care if they're worried they might end up in jail. They might want to consult the ethics board or their lawyer, and that delays care. Now, as a pediatrician, I want to specifically speak to this and also speak to the situation in Washington State. Now, in Washington State, this is not an issue. Washington's been a national leader on reproductive rights, and emergency rooms provide all care, no questions asked. However, just across the border in Idaho, women are facing a completely different reality. In fact, obstetricians and gynecologists are fleeing the state because of their draconian laws. And the state of Idaho attempted to specifically exclude abortion from the emergency services that hospitals are required to provide, even in situations where the mother's life is at risk. Now, thankfully, that attempt was struck down by the Supreme Court. However, this back and forth created enough confusion to make countless women afraid, unclear on whether they could seek care. And then, without the specific guidance put in place by the last administration, doctors once again lack that clarity. So as a pediatrician, I'm especially concerned about how this would impact girls who might need this care. The reality, and it shouldn't be the reality, but the reality is that thousands of girls under the age of 18 give birth every year. And studies have shown that young individuals are more likely to have a high-risk pregnancy. This means they have a higher chance of needing pregnancy-related emergency care that EMTALA guarantees, and that care might include abortion. And the stakes are just too high for us to allow Republicans to implement pseudo-healthcare policy through fear and intimidation and confusion. And my colleagues and I will work to make sure that every woman knows and every doctor knows that the law of the land remains the law of the land. And now I'm happy to turn the microphone over to my colleague from California, Dr. Barra.
Thank you. I'm so proud to stand here with my doctor colleagues. Donald Trump is not a doctor. He did not go to medical school. The state electeds that are passing some of these restrictive laws, they are not doctors. I'm standing here with a group of doctors. And when we entered the profession, we took an oath to put our patients first, to do no harm, to do good, to make these decisions with our patients, patient autonomy. That's the oath that we took. That's the moral and ethical obligation that we had. And as early doctors, we learned EMTALA. We learned that when a patient shows up in an emergency room, we don't see a Democratic patient or a Republican patient. We see someone who is in need. That's why it's called an emergency room. Now, laws like this that get enacted or when the water is muddied, that patient's in front of us. We have a moral and ethical obligation to take care of them and deliver the care that's necessary to save their lives. Dr. Morrison, Dr. Ruiz, and my colleagues have described what we see: uncontrollable bleeding, an ectopic pregnancy, an infection. It's necessary to provide that abortion care to save the mother's life. That is what we're going to do. That's what doctors across this country are going to do. And that is what the law says. So let's be clear. When someone shows up in the emergency room, when that that woman shows up in the emergency room, we're going to do what we have to do to provide the care necessary. What Donald Trump is doing, what some of these state legislators are doing, is muddying the waters and making doctors in those states like Texas uncomfortable. Again, this is an emergency. You don't have time to say, hey, we're going to put you on a plane and send you to California where we will provide that care, or Washington or Oregon or other places. You have to take care of the patients that's in front of you and save their lives. That is what this is about. We have a moral and ethical right as doctors. It is the obligation and the oath that we took when we entered the profession. So to the doctors of America, we've got your back. We're going to fight this, and we're going to honor and uphold EMTALA and take care of the patients that are in front of us. Thank you. And with that, let me introduce my good friend from New Jersey, Dr. Herb Conaway.
Hi, thanks. And good afternoon, everyone. I want to provide go back just a little bit and provide some of the history of how we got to EMTALA in the first place. And I would say to you at the outset that this rule change is nothing but a continuation of the administration's war on the poor, the dispossessed, those who don't have ready access to the highest quality care because they live in a rural area, or they live in an area that doesn't have a great tax base where they can afford, a hospital with all the bells and whistles. This law was passed because far too many patients would end up at an under-resourced hospital, and or because of racism, by the way, and they wouldn't get the care they need, and they would die on the front steps of a hospital. And so the law was put in place to ensure that the poor, the dispossessed, the discriminated against would have at least a fair shot when they had an emergency to get an evaluation in an emergency room, to get care, to make sure they were stabilized, and to be referred to a hospital that could treat them, and put penalties on the hospital and the doctor, by the way, who didn't take these steps. And those penalties are really quite significant, $50,000 to $100,000 for failing to ensure that patients who present at an emergency room that advertises itself as being able to handle emergencies and take care of you, whether you're pregnant and having an ectopic pregnancy, a spontaneous abortion, or other issues, or perhaps a botched one, and make sure that your life can be saved. Now, this administration, again, with the war that it's conducting, muddying the waters, and you all know that there are states, in my state, we don't have an issue with making sure that the woman's right to an abortion, to choose and direct her own health care, is sacrosanct. It's in our Constitution. And many states, other states have done that as well. But we know that a lot of other states have been attacking abortion and the right of women to direct their care and to have their entire health care taken care of by the healthcare system in this country. And the Idaho case certainly is one that's but we're seeing this all over the country. So it matters what state you live in and what the attitude of the hospital with respect to treating the poor and taking care of people who happen to be women and happen to be pregnant and happen to have an issue with the status of their pregnancy. So this rule change puts doctors in a box. It makes the doctor, and you've got a family to take care of. Some of these states, you go to jail as a criminal offense if you take care of a woman who's pregnant and to deal with what she needs, which might very well be an abortion if the pregnancy can't be saved, to actually threaten to put those doctors in jail for doing what they've been trained to do. And they're trying to spread this uncertainty, not beyond the red states, even here to states that are fairly well resourced and have good laws, because they want to make that doctor, they want to make that hospital hesitate. Do I take care of this patient? Can I afford to take care of this patient without either going to jail in some of these states or being heavily fined or going through months of litigation to determine whether or not I acted or the hospital acted appropriately? This is what this is about. It's a war on women. It's a war on pregnant women in particular, and it's a war on people who are poor and living in areas that are under-resourced with respect to their care. That's what this is about. And I stand strongly together with my physician colleagues and hope that we'll be joined by other physician colleagues, indeed, colleagues across this Congress, to stand up against this attack on the healthcare of people. And we're seeing it certainly in the hospital space. Preventive care, this has been mentioned, but let's stick to what's going on here today. We stand against this administration's war on women. Thank you very much. Oh, my.
Are there any questions? Yeah.
So we've seen a number of Republican lawmakers, both at the federal level and state level, who are against abortions and calling for abortion bans, while also calling for provisions to allow for the removal of ectopic pregnancies. Can you explain, sort of go into that contradiction of whether or not that is in fact an abortion?
I think that really gets to the whole challenge of trying to legislate all the nuance that exists in these different clinical scenarios. There are ectopic pregnancies in which a fetus is developing and has cardiac activity. It has no chance of surviving to term. That is considered an abortion.
Yes. They call it what it
So,
is.
yeah.
You know, there's another example, in addition to an ectopic pregnancy, is let's say a woman carried a child to term, and in that pregnancy she had preeclampsia and even had eclampsia, developed eclampsia, had to be treated with magnesium and other medication, and the doctor told her that the next time, for example, that she should avoid getting pregnant because she's very high risk, and the next time could be worse. She could lose her life. So she gets pregnant, and what does she need to do? Are they going to force her to carry this pregnancy and risk her life again? Or are they going to allow her to have an abortion to help prevent death in the future?
What's your message to the Republican lawmakers who are for this provision and who maybe aren't seeing the nuance that you're seeing?
Are they calling out the president right now and asking him to reinstate the guidance for EMTALA? That would be the first question I'd ask them. And then I would say, trust women. Let women make decisions about their own bodies in conjunction with their health care providers. It's not their business. As long as people can become pregnant, there will be people who either need or want to terminate a pregnancy for a whole variety of reasons, and none of those reasons are their business.
I mean, I would just add, most of the folks that are writing these laws and writing these exceptions, they're not doctors, right? I mean, let us take care of our patients. Let us sit down with our patients and let him or her make the healthcare decisions that impact their lives. That is critical. That is the oath that we took, to sit with them, answer their questions, and let her make the decisions that impact her lives. This is going to cost women's lives. Yep. This is going to get in the way. It's going to make OBGYNs, ER doctors in certain states be very concerned about litigation against themselves. And why should a patient in California get full service and a woman in Texas get very different service? That isn't who we are as a country.
Yeah, agreed.
May I add a concise message for them? Politicians should get out of the exam room.
There you go. That's what I was going to say. Got it.
Well, that's what she said.
For anti-abortion advocates and a few people and folks in the administration, the EMTALA guidance wasn't necessary because they say that states where abortion bans are in place have exceptions for the health or life of the mother, etc. I wanted to get your thoughts there about, do those exceptions actually cover what the EMTALA guidance was intended to?
I don't think that every state that has an abortion ban has exceptions, first of all. Second of all, I guess I would reiterate then, what is the point of rescinding the guidance? All it does is confuse patients, it confuses doctors, it confuses hospitals. We already saw headlines over the last week that implied that EMTALA has been overturned, which is not true. It was just the rescission of the guidance. So my question for people who say that would be, what is the point of rescinding the guidance? It's not helping anyone. It's only hurting people.